Good afternoon to everybody. Dear colleagues, today I'm going to present you the Tularemia outbreak in the Republic of Macedonia that happened from December 2014 until April 2015. In the beginning, I would like to give you some information about general information about tularemia. Tularemia is a zoonosis caused by Francisella tularensis, and natural reservoirs for this disease are many animals like rabbits, hares, squirrels, foxes, and ticks. There are several routes of transmission for this disease, and some of them are bites of infected insects, contact with infected animal tissues, contaminated soil, contaminated water, and food from undercooked food. This disease is widespread in the northern hemisphere of the Earth, and the numbers given in this slide are from the last reports from ECDC and CDC about the incidence of this disease in Europe and USA. And in our neighborhood, almost all of the countries report cases annually, and in the same period with our outbreak, there was an outbreak in Kosovo. Tularemia is a mandatory notifiable disease in Macedonia. First cases were registered in 1995. Since then, 2 outbreaks in rural areas were reported. The first one was in 1995 in the eastern part of the country with 31 cases, and the second one was in 2010 in the western part of the country with 20 cases. Individual cases were registered the following years. In December 2014, we registered unexpected number of cases in 3 different regions in our country. The objective of this study is to describe the tularemia outbreak in Macedonia in order to provide recommendations for preventing future infections. As I said in the beginning, this is a descriptive study, so we described cases by person, place, and time. We used the case definition that suggests that a case was defined as a person with fever and lymphadenopathy and fatigue, body aches, with a positive laboratory test for Francisella tularensis. At the beginning, the case finding was conducted by passive surveillance. That means reports were sent to the surveillance units. And after several detected cases, we started to do active surveillance with checking the registries in the healthcare facilities and door-to-door case searching. The specimen taken from the suspectable cases were sent to the laboratory in the Institute of Public Health, and specimens were tested for confirmation with microagglutination test and/or ELISA. The data was collected with a face-to-face interview using a standardized questionnaire that was structured in 6 parts. General information about the cases, clinical signs and symptoms, outcome, exposures, laboratory confirmation, and treatment. Also, we have done some environmental analysis, and we were in coordination with the veterinary authorities. So from December 2014 to April 2015, 34 confirmed cases with an incidence of 4 over 100,000 population was registered in Macedonia. So in this map, we can see that the highest number of cases was reported in Aracinovo, that is the darkest one, and followed by Lozovo. While in the other regions, we registered only 1 to 3 cases. The highest attack rate was reported in the regional center of public health, Veles, with 16.1 over 100,000 population. In general, from all of the cases, 85.3% were from rural areas, and that number in Skopje was that percent in Skopje was 88.2%, and in Veles 85.7%. This is a figure with the most recorded tularemia symptoms in this outbreak, and we can see that enlarged lymph nodes, high temperature and fever were the most recorded tularemia symptoms. I must stress out here that the time period from onset of symptoms to reporting, it was varying from 0 to 101 days, so it has a mean of 45 days. This is a figure of the distribution of tularemia cases by sex and age groups. We can see that the highest number of cases is recorded in the age group of 20 to 29 years with 41%. The age varies from 11 to 74 years and a mean of 38. And the sex ratio in this outbreak is 1:1. This is a figure of the distribution of tularemia cases by place and week of onset of symptoms. And we can see that the outbreak started at the end of December 2014. That has a peak in mid-January 2015 and it ended in April 2016. We can also see that cases were reported from Skopje during the whole period of the outbreak, and from Veles, it was only in the first half of the outbreak. This is a table of the distribution of tularemia cases by occupation. After doing interviews, we saw that most of the cases were farmers, so 16 of them, and the other half were people in contact with them, so either living with them or in near proximity, like housewife, pensioners, or child. Only 3 people were neither farmers nor in contact with them. This is a table with the distribution of tularemia cases by possible exposure. And here we can see that 20 cases drank unsafe water. That means they didn't have access to central water supply system. They have local water supply system or personal drills and wells. We can also see that 13 cases had contact with rodents, mainly rats. And we can see that 16 of the cases had contact with domestic animals, but this is not surprising because we saw previously that almost 90% of the cases were from rural areas. The results from the environmental analysis suggest that all 5 specimens of water from different locations in the region of Lozovo were microbiologically and or physically and chemically unsafe. And the 32 specimens of water from different locations in the municipality of Aracinovo, 69% of them were microbiologically, physically and chemically unsafe. The Food and Veterinary Agency informed us that there were no reported tularemia cases in domestic and wild animals in the period of 2010 to 2015. The limitations of this study are underreporting because of the general practitioners did not take in consideration tularemia in their differential diagnosis, so there is a chance that we missed some cases and that the analytical study was not conducted. As a conclusion, we can say that there is a continuous potential risk for tularemia outbreaks in Macedonia, and that the causality with this study was difficult to interpret, so that we need an analytical approach which will give possibility to confirm the possible risk factors. As a recommendation, we need to strengthen and improve the coordination between health and veterinary authorities. We need to advise healthcare practitioners to take tularemia in consideration in their differential diagnosis and to raise awareness among population for the risk and ways of prevention. Thank you for your attention.
Thank you very much for the excellent presentation. And now we open the floor for questions for Dragan. If anyone would like. No? In the meantime, so if I understood well, there was no increase in the number of rodents that were dead or any increase in wild animals at the same time?
No.
Yeah.
Okay. The Food and Veterinary Agency said that there were no reported tularemia cases in animals in this period.
And I was just surprised. So I'm on the, okay, well, maybe. Okay. So your definition of farmers, there were 16 farmers, but then only 7% were working on the field. So is most of the farmers, they just...
Well, farmers working on a field or working with domestic animals, they're all farmers.
Okay.
Ismail.
Dragan, thank you for a very nice presentation. If we go back to your first slides, we realized that mainly reservoir of infections are rodents. So somehow doesn't make too much sense to look for reservoirs at domestic animals, because rodents are mainly reservoir of infection, and through their secrets on water and food, the disease transmits to the human beings. And yes, it is correct now in your table here. Just to go back and again to your slides, when you mention contact farmers and contact with, in contact with farmers. Did you consider here in contact with farmers as a mode of transmission?
No, not as a mode of transmission. That because they lived in surrounding of the farmers, or in near with them or in near proximity to them, not as a way of transmission.
Okay.
Because they have been, they may be exposed to the same exposure. That's why we did it like this.
Okay. Another question is about geographical location. They are in Veles, Kumanovo, and Skopje.
Yes.
They are somehow very close to each other. Yes, more or less. More or less.
More or less, yes.
More or less. Is there any risk factors or any specific reason of location of the disease or distribution of the disease in this area?
I don't know. We have some. We had some floodings in 2014. Maybe that is the reason. We had some floodings in 2014.
Thank you.
Any other questions? No? Then I will run an applause for Dragan. Thank you very much.